We start with some exciting news today. Niagara Health is partnering with Ronald McDonald House for a new family room at the St. Catharines Hospital. Mario, construction has already begun on this?
Yes, it has. The site is hoarded up right now. Don't ask me what's going on today, but I'm hoping it's progress.
Silvergate Homes is doing the construction. How did you connect with them?
Yeah, correct. So, most of the things that we do in our house and the people that we work with, we support families. So a big piece to like any of the work that we do on a procurement level is trying to look for vendors who are also, big family supporters. And if they are a family business, even better yet. So Silvergate Homes has volunteered actually in our main house in Hamilton several times and knew about the project. We've seen what they did with other kind of, commercial spots. Like at Tim Hortons, they've actually re-renovated into a beautiful spot. So I had a conversation with John. We had some proposals that came in, and it was very easy to make the decision with Silvergate. And because they're such a family-oriented business and family,
right,
having them walk through that space, created as if it was one of their family homes, it was a perfect match.
Natalie, this is a game changer for Niagara Health.
We are so excited about this, and a great way to support our patients and families.
Tell me about this room and how this all came about, I guess.
Sure. Well, we had some space available, looking at how we can support our families. And then the Ronald McDonald Charity approached us, and we thought, what a better way to use this space and support our families.
Mario, you have two of these rooms in Hamilton. One is actually in your Ronald McDonald House there.
Yeah, so right like where our house is located, Mac is about a 5-minute walk. So we have two current family rooms. One is right next to the ICU, and the other one is right next to the main pediatric unit. They're very, very busy rooms. We see roughly about 7,000 people a week kind of come in and out. And we still have plans to expand within that hospital as well.
This is not designed for overnight stays. It's more of an area of respite.
Yeah, correct. So Natalie would probably be better to answer like the flow of like what families come. But within MAC, we have families that could be a Ronald McDonald family for, upwards to a few hundred days. And we had a family out of Welland last year that stayed with us for 410 days.
Wow.
So those rooms were their everyday spot where they received, food, programming, and just connection with other families that were kind of in the struggle.
Natalie, there's going to be some programming in this room as well, correct?
That's right. So we're looking to use the space to support our families with some daily activities and just an ability to take care of themselves while they're taking care of their hospitalized children. So we have our social workers who will be supporting some groups with parents, and a child life specialist as well, who's going to be developing some programs to support families and siblings of hospitalized children.
It also has, I guess, the ability to host some gatherings. For instance, some movie nights and things like that?
That's right. So we know that being in the hospital can be a little bit isolating. And so we're trying to use that space as, a common area where you can socialize with parents who are going through the same thing, get to know each other, support, lean on each other, and be just steps away from their children who are hospitalized.
Free food for the people that use it, laundry facilities?
That's right. So as you know, the hospital is a regional center. So we have a large neonatal intensive care unit and a pediatric unit. So to make sure that we can support families to be in the hospital with their children, they will have access to laundry, to food, and coffee, drinks while they're there.
It's really a godsend for these families.
It is, and it's a game changer, and we know that to take care, it's so important for them to take care of themselves, and having this opportunity, being supported by our volunteer services, it's just such a great way to improve their experience while they're with us.
Mario, how is this being funded?
So Ronald McDonald Global and McDonald's Canada typically pick up roughly 50% of our capital builds. The other half is just ourselves fundraising it. So we've developed a great partnership with the St. Catharines Club South of Rotary and then the Maycourt Club of St. Catharines, and they're helping us throughout the summer fundraise for the remainder portion and some of our operating funds. But we're also going out there to our current donors, to the Niagara community, and asking them to visit our website and donate through that portal.
When is, I guess, the scheduled time for this to be open for families to use?
Yeah, we're hoping for September, and we're pretty confident we'd meet that deadline as well.
It's fantastic news. Natalie, Mario, thanks so much for telling us more today.
Thanks, Mike.
Thank you.